So I'd like to welcome everyone to Mental Health Monday. This is a production put on by NAMI Yavapai and the Northern Arizona Peer and Family Coalition. So welcome everyone. And Lori is president and chair or whatever, the head muckety muck at the Northern Arizona Peer and Family Coalition.
So thank you, Kathy. And I want to welcome our panelists. We have Tamara Player, who is the CEO of Polara. And we have Trish Reiner. Trish leads the Family Involvement Center in Prescott. And Kathy Basher is president of the Arizona Peer and Family Coalition and also the president of NAMI Yavapai. So with that said, we'll let it go.
So I'll kind of open up the discussion. As you guys know, the coalition has been very active in Northern Arizona on issues relating to choice. And we had very serious concerns because we didn't see much choice happening up here for years. And it's been a big kind of an RFP, piece as we move forward. And so, as you guys know, choice is mandated by SAMHSA. It filters all the way down. But I think in many ways it's impacted by the funding streams. So, and I'll come back to that in just a minute. I'm trying to lay a little bit of the groundwork, especially from Tamara, because she has not been listening to these discussions. And we've had the CEOs of a number of the health plans in REBA. We've had a lot of people in this discussion as we move forward, but what we haven't had is providers. And the concern that I have had is that the providers in some ways, I feel, have been kind of caught in all of this because SAMHSA has mandated choice. It's come down to access, and access has tried to support that. But yet the funding streams and some of the activities that happened in Northern Arizona were not in line with producing choice. And I think some of the things that happened were that we had health homes up here. The health homes mainly, of course, communicated with each other. We know that we tried to bring in other providers. They couldn't make it because they didn't get referrals. And so at the same time, I think the health homes were probably encouraged to increase peer family support, kind of a one house or a one stop shop in a sense. And so I think now with the change in the REBA and the plans, I suspect that some of the providers are kind of left with, they have these resources, they built the capacity to what they were asked to by their contracting agencies. And so, kind of that needs to be considered as we move forward. So Tamara was courageous enough to come and speak with us. And so I'm going to kind of open up this discussion, and Trish, we'll give you a couple of minutes, both of you guys, a couple of minutes to kind of share your feelings. But I think that kind of puts a parameter on it, what's going on up here. And it's not just Yavapai, it's all of Northern Arizona. That there have been serious challenges. As a matter of fact, Christina and Lori and I are going up to Bullhead City. Is
Kingman.
Oh, sorry, Kingman. Okay, we're going up to Kingman, where it's even more challenging up there. Okay, I mean there is almost no choice. So I'll turn it over to Trish, and then we'll let Tamara talk for a minute. Go ahead, Trish.
You want me to kind of talk about choice? What that?
You can say whatever you want as a parent and as a provider. And the challenges you've met as an agency.
I think as a parent, what I have seen over the years, let's see, I'm trying to think how to say this. So definitely the system has changed over the course of the past several years. I think in the hopes and ideas was with that change was to also bring that choice so that people have choice of where to go, where they get their services. But I also see that with that, we've had a lot of barriers to get through on the kids side. So this is specific on the kids side. When we talk about parents can go anywhere for services, they can walk in, no wrong door. You can do that, but there's other hoops that we have to jump through as providers to ensure that kids are enrolled in behavioral health. We still have to look to try and get some of those, that connection, possible referrals from agencies, the behavioral health home. And I think that's been really challenging for parents to try and do that. So as an agency, we're able to do our own intakes, and we can enroll families with that. But what I find is when we do something like that, we're kind of disconnected from the health homes. And what we want to do through Family Involvement Center is to partner with those health homes. We're an additional support to the family, additional support to the team, and really having us all collaborate together would be ideal. And sometimes when we don't get those referrals, we're not connected to the health home. So I do see that as some of the challenge that families are kind of now facing, even though we're told that there is a lot of choice out there.
So Chris, just to get a clear understanding, how do you know that families aren't given a choice?
Well, from when we do get connected to families are not aware of family-run organizations. So that's straight out from their conversations that we have with them. We do some community forums here, and most of the parents there say, I wish I would have known about you 2 years ago. I wish I would have known several years ago. So I think, that's the biggest thing. Everyone is going to be funneled through our system. They get funneled to the behavioral health homes. And some of those health homes are very large. So that would mean educating every single one of those health home providers or staff members on family-run organizations, on giving parents that input. And so I think that would be a huge ongoing training need too, with turnover and all of that. But a lot of the health homes, some of the newer stuff, they don't even know what a family run or a peer run is, unless they've worked with them or they've, been told by a parent or someone else. So.
Okay, Tamara?
Yeah, so I just want to start with what does choice mean to me, and then I'll kind of share my experience. So choice for me as a parent, as a family member of, my family has needed services over the years. Choice is about, as an individual, being able to find the best person and the best fit for me who can meet my needs, right? And that varies over time and over space, depending, and over, whether it's a child or a family member or whatever. But choice is something that's really important for me as a consumer of healthcare services, right? It allows me the flexibility to engage who I feel is the best of the best for whatever the situation might be. As I'll talk for a minute as a mom, and then I'll talk as a provider. So as a mom, 2 of our children struggled with suicidal ideations. One we knew was struggling. She was diagnosed with cystic fibrosis when she was 9 months old. And so she, struggled with mental health challenges throughout her life. When she was born, life expectancy was 24. That's hard to swallow when you're 13 years old. And so again, being able to access care. Because I lived in a rural area and we had the mental health center, I worked at the mental health center. It was really hard to access care for my daughter, quite honestly. To your point, Kathy, there weren't a lot of other options available. And so, that was something we navigated because she wanted confidentiality, right? She didn't want her mom to potentially get this information. And so it just became a challenge from that perspective. On the other side, our middle son was having suicidal ideations, and we had no idea. And if it wasn't for community conversation, he might not be with us today, because he happened to say something to a friend and who said something to their parents, and the parent called us. And so then we had to navigate the whole system that way. He was okay accessing care a certain way, but they totally shut us out of treatment. Because in Maine, if you're 13 years or older, you can limit who gets information, and he was an angry adolescent boy who needed us to be involved, and we were shut out of care. So I understand it from accessing care and how important choice is to being able to find services for your family or loved one, to be able to be included in that. And, Trish, you talk about, man, it would have been really nice to have somebody help us navigate a system, even though I work in it, right? It's that complicated. As a provider, I would say I totally believe in choice as well. And I read this article from Health Financial Management Associates, I think that's what it's called. And it says, as a healthcare system, we are resource rich and coordination poor. And I think that drives so much of our system, unfortunately. So, I joined or moved to Yavapai County in 2019, right before the pandemic. And at that point, there were a number of providers, right? So we had West Yavapai's, now Pallara, Spectrum, Southwest Behavioral, CFSS, Granite Mountain, Arizona Children's, FIC, Taros, Catholic Charities, right? There was a number of options there. On the peer side, we had NASCARE. And I think, Veronica, you had left right around that time frame. I don't know exactly when you left in there. And so, there was lots of choice in terms of health homes for families or for adults who wanted services. And even for families, right? We had a number of health homes that provided services to children and families, and we had Family Involvement Center. At some point in time, my kids was up here, and I don't know, Kathy, if that was one of those, because health homes didn't make enough referrals. I don't know what happened there, but my kids ended up, I think, pulling out of Prescott. I think, Trish, you said something that is really important, and that is we can educate people on the services that are available, and then we get busy in our life. We're a human system, and who's resource rich and coordination poor. And we don't always do a good job as providers of saying, and here is the plethora of everything you can have. And oftentimes, at least in my experience, both as a family member and as a provider who provided intensive in-home services to children and families, people are overwhelmed. People don't know what they need, right? You don't know what you don't know. And so you're trying to navigate a complex system. And again, just being overwhelmed, we might not always say, yes, we need that, or I need that. So I think those are some of the challenges as a provider that we face, is just remembering to talk about all the services and the supports that are there, engaging the families, helping families. Again, I'll go back to, I didn't always know what I didn't know or what I needed. And so being able to really help to say, actually, I think this would be really good for you. I know it seems overwhelming right now. They can be a voice when maybe you're struggling or whatever that might be. And then I think the other piece as a provider around choice that I find as a barrier is just, and I'll talk about SMI peer from that perspective. We had one peer provider up here, and that was NASCARE. I'm not saying anything bad about NASCARE, but just like clients have a bad experience with Pallara or Spectrum or Southwest, right? Or we're just not their cup of tea. If if NASCARE wasn't your cup of tea, there wasn't another option. And so I think, Kathy, that was one of the reasons, at least from my perspective, why I've continued to have peer services at our organization. It wasn't that I didn't want to refer out, but people need choice. And we don't have a lot of choice in Yavapai as it relates to peer services. So when Dan first reached out, you know, it was stopping to understand what that would mean, what the partnership could look like. And, you know, I think with Hope Inc., I think they have their contract now in place, and we're just waiting for them to hire so that we can have them at our CSU and at our hospital, because NASCARE has really struggled to do that and to provide those services and to be that bridge, because we know if we don't do it, then if we're relying on our staff to do it, it's going to be tough. So I've said a lot, way beyond the first question, Christina, about what is choice.
Yeah, go ahead, Christina. Oh, okay. So the issue about NASCARE, I think we're all very aware of, and it created a lot of problems because they just were not able to offer what our community needed. And I think everyone here is very, very aware of that, and that will change. But I think the other piece to this is that there have been other providers that have just left because they couldn't get referrals. And the same challenge with the family runs is that they, you know, really have struggled in getting referrals. So Trish, do you see anything that Tamara has shared that kind of opens up the door to more sharing or partnership? And as a matter of fact, you know, I don't even think on the adult side, I hate to use sides, but we really don't have family support up here, do we, Tamara?
Well, I would say NAMI's that family support on the adult side. And then I think our peer runs do that too, right? I do think that there's engagement that happens there for both of those organizations, that families have the option to really engage in NAMI, because I think that's a really great natural support for families with adults with serious mental illness. And I also think our peers, they don't just provide services to just the individual. I do think that they engage the natural or family supports as well, as the individual's comfortable with, right? Not everybody wants that either. So,
but yet, you know, it's been pointed out to me that many staff members of the health homes don't even know really what NAMI is and what we can offer. And so I think we're in the same position that FIC is in, that there's this knowledge gap. The resources are there, but how do we connect to them?
Yeah, I think so. You know, and Trish, you might be able to talk about this better than I can, because I've kind of stepped away from it. You know, we work together, FIC and Pollara, to build a partnership where and we were focusing on birth to 5, but every family that got referred to us birth to 5 automatically got connected with FIC. And we stepped out this process where we were a team, all working together, all there to support the family. We did it under our Best for Babies Yavapai initiative, really with the goal to expand that, right? If you have, because it removes a barrier, right? So if you have staff that are interacting all the time together, then it becomes really easy to bring in this next family that, and so I don't know, Trish, how things are going, or if you are still engaged, or if it's our staff who are primarily doing that. But what is your perception about that partnership? And do you think we've been able to accomplish some of that, removing the barriers for families to?
Yeah, first, I want to clarify, Kathy, something that you mentioned. So Family Involvement Center also provides adult family support as well. I think we have one family that we're working with up in the Flagstaff area to do that. So that is something that our parent peers are also trained in and able to do. We do have that partnership with Polara. It's part of our Parent Support Now program that we have with the judge here in Yavapai County. The other health homes as well participate in that as well. But so we meet, I think, with the Polara group every other week, and that's been really beneficial for our folks here and Polara's folks to really kind of talk about, you know, what do we need? What does this family need? How can we both come together, and maybe Polara takes one piece of the puzzle that the family needs and we take another one. So that has been, I think, a really great collaboration for the families and helping them to meet their reunification goals sooner. So I think that's been definitely really helpful to have that connection, because we get to build those relationships. And I think, you know, on their baby team, we know exactly who to call over there and who to connect with. And, you know, they know who to call over here with us. So that's definitely been a big plus for our partnerships.
So this is wonderful to hear. So you have worked through some of the challenges. Now, are you going to extrapolate that to some, you know, the beyond 5 years old? Is there any ways of looking at, you know, how to extend that, or has it just kind of stopped at this point?
For us, so our Parent Support Now program is beyond 5. So we work with the baby team at Polara, but they also are our main contact for family, anybody who's been involved with Department of Child Safety. So we still go to them and connect, and they get us to the right person at Polara. So for us, we still work with that specific team, but they get us to who we need to talk to for kids that are over the age of 5. So it still works.
So from what I've understood, your piece of the pie is really through the courts. Is that correct?
This, yeah, we started this with Health Choice when they were the REBA up here. So they kind of spearheaded that, got all of us together. And then we worked out the process and how this would work for families in Yavapai County that had any removal.
But the Birth to 5 program, Kathy, wasn't necessarily through the courts. I think a lot of them came through the courts, but this was we were really trying to build off the Best for Babies, and so developed this Best for Babies Yavapai because we were implementing, or we wanted to implement, a program similar to Cradles to Crayons down in Maricopa County, which was very much connected to families, you know, FIC.
Mm-hmm.
I'm not sure if you're down there, but with Best for Cradles to Crayons, but we were trying to bring that model here. So just, you know, said, hey, would you partner with us around doing this? I think there's more opportunities to expand that partnership, but I think what Trish is saying is true. When there is a strong relationship from provider to provider, and we know who to call, again, it removes some barriers. And even before developing this partnership with FIC, that then allows it to expand to anybody. And we still have work to do, Kathy. We absolutely have work to do. With NasCare, we had NasCare coming into our hospital and our crisis units to run groups. And that was because what we wanted to do is exactly like developing those relationships with the staff, being there to connect with people during some really vulnerable times, so that it was a natural transition. As someone transitioned out, I already knew Kathy Basher, and I felt really comfortable having Kathy come to my house and wanting to engage with Kathy around peer services, right? That kind of connection. So, you know, again, I came here in 2019, the pandemic hit. I think NasCare, like all of us, really struggled with staffing. And so they haven't been able to do that. So we've already talked to Hope Inc. about starting that when they have the staff. Because it removes that barrier.
As you're talking, I'm thinking back about my mean little thoughts towards you and Polara, the rumors that went on in the community, and now I'm hearing a real different side, a real piece of attempting to remediate some of these challenges. And I think the piece that's missing is more of an open community discussion. Had we had some of those discussions back then, maybe things I would have had better thoughts all along. So, and I'm kind of joking, but you know, I came up here with the idea that it was a very closed, kind of hostile system. And I'm getting another view now as you share, and I'm seeing possibilities as we move forward that, you know, could be helpful to every one of us. George, you had a question?
Yes, thank you. However, you have to be over 5 for this, so I apologize. I saw last week that SAMHSA is issuing a grant to crisis service providers who operate 24/7, and they're issuing 10 grants at $500,000 a year, and it's for continuation of services. So this is where my point came up, is that Tamara had mentioned coordination, poor coordination. And SAMHSA, I think, is addressing the same thing, saying, let's follow up with people afterwards.
Yeah. So George,
thank you.
We're in the process. We're looking at that grant. I'm not sure if we'll decide to bid on it or not, because we're in rural Arizona and numbers aren't great. And so those SAMHSA grants tend to go to like Maricopa, right? Phoenix, where they're going to get the numbers and really be able to test some things out. However, regardless of the funds, we're developing what we're calling a transitional care team. And we hope that Hope Inc. will join us as part of that transitional care team. So anybody that's leaving our crisis unit, our hospital, or our substance use residential program will be assigned a care team that includes a peer, a nurse, and a case manager is what we're thinking at this point in time, who will follow that person for at least 30 days after that higher level of care. And that's to do that care coordination. That's to get that individual tucked back into their outpatient team, right? We know our outpatient teams are already booked. And we know that time frame is 72 hours after someone's discharge is really high risk for them, right? And so how do we wrap around them? We would love, and we talked to Dan's team back in, I think it was November, and then my clinical team has taken it, so they might have had more conversations and I'm not up to date. That happens a lot for me, but anyways, where again, that if we would love if we had the resources, and if it's not a peer, then it's a case manager, a combination of them, that actually picks the person up if they don't have transportation, takes them home, make sure they have their meds, make sure they have food, make sure they have a plan for that night, supports to wrap around them. Someone's calling the second day or going over to the house the second day, but just this good wraparound services. It's not the total care coordination issue, George, and we have a lot of work to do as it relates to that. But I think any place that we can embed our family involvement center, our peer services in, I think the person gets better care and reduces the impact for them, the impact of potential having to go back to a hospital. Again, just closes a gap that our healthcare system, we can't close with the current services, or traditional, I'll call it, however you want to call it, not to be offensive, Kathy, so jump in and correct me, but so we're exploring how we can do that in the best interest for our clients and the people that we all serve, right? And we're here to take care of.
Tamara, this is Lori. I'm encouraged by what I'm hearing. A question that comes up for me has to do with kind of the boots on the ground at Palara, on both the youth and the adult side. are the families and are the clients aware of the choices? Do you have flyers in the lobby for FIC as you find the dimensional shift in choice with hope in your community? Are the case managers, care managers knowing what's going on, and that this is something that enhances, doesn't take away from what they may be doing?
You know, Lori, I'd love to say, oh yeah, we've got that covered. And what I will say is, I think we have moments where we do a really good job. But in the day-to-day, as staff turnover, do I think we do a good job there? No. And actually, as we were talking, we have new employee orientation, and I was like, oh, we need to have family and client choice there, right? I had talked to our partner advisory council, and they're members who receive services throughout the community. And about doing a video or participating in that. And so that's back on my agenda to follow up on, to say, you know, that needs, every new employee needs to hear about that.
Excellent.
When I say we've had some shining moments, like for a while, we got NASCARE to send us over all of their group services. And we have, it's called the Polaris Star. And it's a newsletter that goes out to all clients, and it's available in our lobbies. And so it listed groups that NASCARE was doing. So we have moments where we do really good at that. And then, you know, that moment's done. But I don't think we have a good process where we constantly do that. And I would say, I don't know that we have anything at FIC, at Cortez or Windsong. Do you, Trish, do you know? I don't think we do.
I don't think so.
I don't think we do. And again, it's not that we don't want to, it's the momentum of life, right?
Yeah, and turnover is a piece, and ongoing education is a piece, and having people know what's available, from whom, when and where, what it is. I know in the 16 years that I worked for Spectrum, which was Verde Valley Guidance Clinic for many years, one of the roles that I had was I was one of the people that any new employee spent time with. I was one of the NEO trainers, and the topic was recovery. What is recovery? And that's how I would start, to get an idea and help people expand. I can tell you that the majority of them said, "Oh, it's substance use." They think recovery, and that's the first thing that comes to their mind. It's much broader, as we all know. But I think it's important. I'm glad to hear that in your new employee orientation, you are providing them with some exposure.
Yeah, our peer manager does that. And again, many of you probably know Katie Welty. She was a strong advocate of that. And so she started that initially when I came on board, because we didn't have a new employee orientation. So she, as we were developing that, she was definitely a strong advocate to say, we need to have peer representation. And many of you might have attended her training where she talks about
Stigma.
Not just, it's stigma is one of it, but she also talks about compassion fatigue, and how compassion fatigue on the provider side leads to us stigmatizing, right? And I always felt like that was such an important message for every new employee to hear around. You've got to be aware of your unconscious bias. You have to be aware of taking care of yourself, because when you're not, you're unintentionally, you blame the client, and it's not about the client not wanting to take their medications. There's something going on, and that's our responsibility to be healthy and well enough ourselves that we don't stigmatize and blame the client. And so again, Katie was an amazing advocate and shared that. And since Katie's left, Tina does that now for us and participates. But I still think that there's more to do from a client perspective, Lori. And so this conversation again is just bringing it to light for me around, we need to get back and either have someone from our partner advisory council participate, or do a video that we can share whatever they're most comfortable with, just to really share that.
As I look at the question number 4, how can we increase choice for our members? another thing that came up in some of the recent OIFA, Access OIFA meetings where they were asking some of the questions, some of these same questions. One of the suggestions that came up was have like Family Involvement Center, have someone from FIC come and talk to the case managers in one of their supervision meetings. And that would be on a periodic, not a one and done, due to turnover, to help. I mean, how do we keep the information flow? And, you know, what is the exposure of people, staff from the different providers? What is their exposure to each other to build that camaraderie and working relationship where it is, we're in this together to benefit the members. It's not a competition. Somebody sitting in a seat at FIC isn't going to take the money away from Clara. I think, you know, that's the old culture that we have hopefully continued to dismantle.
Yeah. Yeah. Again, we're totally open to that. And I know Trish is open to that too. I don't want to speak for you, but just in my experience in collaborating with you and Kent, like it's just been wonderful. And I think, you know, Lori, we can do that and get that scheduled on a regular basis. I think where you see change is when those relationships are so tight, like we have with our baby team and FIC, that there's a definite point of contact, right? There's always an open line of communication. There's a commitment to this larger vision. When you have that momentum keeps you going forward, even with the momentum of the day to day. And I've got to return these 10 calls and I need to do that, right? That I think is sustainable. It's the one and done, or even if it's a quarterly thing, I just think we need to invest more in developing those relationships, or structuring the system such that it supports the development of the relationships. So historically, FIC had a staff member in our office at Cortez. Trish, that was way before my time. Do you remember that? Were you at FIC then?
We did not. We didn't actually have someone that was in the office. I think that was Riaz. That did join, you know, had some co-location going on when they got the first contract in Northern Arizona in our area to provide family support.
Yeah, but that's something, again, embedding, part of the conversation with Dan, and again, we could do this with FIC, was embedding staff right into particular sites and locations. Because again, if your staff are working together every single day, then it's top of mind, right? You just become an extension of the other. And so I think, you know, how do we set up the system to make it really easy to reinforce choice and to collaborate?
So this is absolutely fascinating to me, because I'm regressing as we talk and thinking, you know, 15 years ago, first in Southern Arizona and then in Central Arizona, how we got involved in choice and just really, really raised hell with the system and how it came to be. And every now and then the system slips a little bit, or not every provider offers choice, but we had conferences, we had all these, you know, it was just a constant conversation. And so the one thing that stands out to me, Tamara, the issue that you raised, you've talked about integrating it. And that takes a lot of effort. I totally understand, because I have a vice president that I have set up every 2 weeks. We're supposed to talk. And when he doesn't, or I don't show up, or he doesn't, I lose 2 months worth of whatever I just lose it and I can't get it back. So this whole integration and setting a pattern and a routine, I just really had never realized how important that is. And you're doing that up here really without the support and a lot of the resources, because you don't have the pressure like we were able to do. I mean, we just don't have the numbers up here. Yeah. We don't have a strong parent family community. So, you know, this sounds really exciting.
Yeah, well, again, I think that, so Kathy, I'm from rural Maine, to be real. And so when you grow up in a rural community, you all, in order to serve your community best, you have to come together and you figure out systems, right? And so if somebody had to open up an office, that could be cost prohibitive from them to be able to do it. But if they were able to share a space or be in a space with us, then that all of a sudden made a service available to our clients that wouldn't have been otherwise. We brought in primary care. We partnered with a federally qualified health center in Maine because we knew people that we were serving weren't going to get care. So we're like, let's remove that barrier. Here, you give us a doc 2 days a week. We'll fill your schedule. We'll give you the space. And then people who don't get access to care. So again, I think part of it's just growing up in rural Maine. You know, the community that I lived in, we had 12,000 people. So it's very rural, really, you know, small communities, but we got a lot done, and we got a lot done for our community because we were willing to collaborate and set aside some of our own, well, just to manage our competitiveness differently, I guess I'll say it that way. So I'm excited to be able to do that here. I think that shift was starting to happen in northern Yavapai, northern Arizona and Yavapai County before I even got here. But since being here, you know, we've just had the opportunity to do more. So my hope is that as you engage with Kingman and Coconino and things like that, that some of the energy that's been coming north will continue to go to the rest of northern Arizona.
Well, it's got to go to the providers that have been left out too. The providers that tried to make it up here and couldn't get referrals, the providers that cannot get contracted with the REBA. So in many ways, we really don't know really what the needs are for, you know, for choice. And I think you're going to become a Center for Excellence in Autism. Is that correct?
Yeah.
That's major for our community, because, you know, we hear the horror stories about especially that population. So I think that part is important. Christina, you've been very quiet.
Yes. Well, Kathy, I was letting you run the show here.
But I don't want to run the show.
But yes. But no, you guys have been doing a great job. I was just sort of trying to think about, and this has been a really great conversation, about what are some things that we as a system can do differently to help ensure choice for our members. You know, we've been having a lot of conversations with the governor's office and a lot of different areas. I mean, we want to strengthen the work that you're all doing now, so we get to a point where we don't have to worry about our folks being in secure housing in the state hospital, in jails or prisons, right? We want to strengthen the system on the front end. And I think, you know, I think, you know, Tamara, your point about, you know, resource rich, like how true is that, right? But at the same time, we also know that the providers struggle with resources as well.
Oh, yeah.
And having run a peer-run organization myself prior to going into consulting, it's not easy, right? I mean, you're really resource lacking. You have case managers and providers that are coming to you as an employer who are not aware of peer and family support. And sort of a side shift, I teach social work at ASU. And one of the things I've incorporated into my class now is I'm taking my students to a peer-run organization so they can see what specialized services are available, what it looks like, and how it can benefit the care team. And as a social worker, I still say that peer and family support are one of the most effective parts of a treatment team. And so, of course, some of us are biased in that area, but how can we as a system support that choice, knowing that the more choice our members have, the stronger they're going to be, right? The more we collaborate and connect with others, the stronger our own organizations and companies are going to be. So what can we do to help strengthen the system? And Trish, maybe I'll look to you first. from your perspective, what can FIC do? What can the system do to help strengthen that coordination?
I think one of the things is, you know, helping us get out the word that family runs are here. We are not a behavioral health home, say like Pollara. So we are a specialized provider that focuses on providing that support to parents and family members on both children and adult systems. If we don't get someone enrolled with us, we don't get paid. And so one of those other challenges, I think, for us is on the preventative side of things is other funding might go to behavioral health homes, but they don't come to family runs as much. And so I think that's something that was a little different in Northern Arizona, that before all the system changes was all the funding went to behavioral health homes, and we really rely on them to share all the information with parents. And so we could use some help getting the word out that family runs are even, you know, available in Arizona. The value of that, kind of some education. I know in the past, we've done road shows where we've gone and done a lot of presentations to all the behavioral health homes, specifically in Northern Arizona, and just connected with all the health homes throughout Northern Arizona about those benefits. Because I do think there's still this understanding that somehow we are going to be taking away something from the health homes. When we're looking to partner and we're looking to, you know, to assist those families for the best outcomes. We're not here looking to take away. I think there's enough people here that need support and are not getting it for all of us to be able to work together. And I think that, you know, those are things that we can do. Our Parent Support Now is a great example of how we've been able to come together for a specific population and work together for those best outcomes for the kids and the families in that. But again, that doesn't translate into the other things that we do for all those kids that aren't enrolled in involved with DCS. I would love to partner with you, Tamara. I'll use this as that to even on your Center for Excellence for Autism. My son is actually enrolled in an adult in Pollara with autism. And so those are those pieces that I think, because there's so many resources out there, it's better for us to all work together than anybody trying to do this individually.
And Trish raises another issue, Christina, that I just got real excited about: prevention. You know, historically, our system has not been involved in prevention. And the governor's office has indicated a real interest in getting back to that model. And that's where it is. It's the specialty providers. It's the stuff that you do. We've got to do some education here, Christina. I just saw an opportunity.
Yeah, absolutely. And we definitely need to be doing education. We need to, you know, we need to make sure OIFA departments are doing education on this as well as Access OIFA, right? This is something that they have the one-pagers on, they have the educational piece on. We need to be doing more about educating professionals before they enter the workforce about what peer and family support looks like, right? They need to have a better understanding of what that looks like, but also understanding the benefit of it. And, you know, to Trish, to your point as well, we're all spinning our wheels with workforce shortage issues, right? I mean, we're trying to, you know, get folks with criminal justice backgrounds hired now to help fill the gap for workforce shortage. I mean, this is not something we can do internally. This is not something we can do alone. We have to work with each other. And, you know, I think in our conversations with the governor's office, they get that and they want to see that. You know, they're looking at the Arnold Soren lawsuit and taking a look at the need for specialty services such as family and peer support and how we need to be collaborating with those specialty services to really prevent and help our mentally ill population, especially our seriously mentally ill population. So Trish, that's helpful. And I think, you know, with conversations like this, I think it's all helpful for us to sort of take like, all right, here's some things that I can leave this conversation away knowing that I can do. On behalf of the coalition, we can do more to educate the public about mental health about family support and peer support, right? I think, you know, when I ran Cheers Recovery Center, I would drop off flyers in the lobbies of the clinics and just hope and pray that they stay in those lobbies with hopes that they'll get handed out or folks would be aware. But also made sure that I made sure that door was open for me to come in and share about peer support, as well as family support. I know we would recognize those organizations or those clinics who provided referrals or quick paperwork over to us. We would recognize them in the community and really strengthen that relationship with them. And we found ourselves then referring a lot more clients to those organizations that referred back to us, right? It's a win-win. The stronger one of us can look, the stronger the others can look. So Tamara, then back to you. What can we as a system do, or we as an advocacy group do to help increase choice for your members?
Yeah, I think the education, I think, is really important, right? If people don't know, then they don't even think to ask. That's a huge thing. We started it's called the Polaris Star, which is for all of our clients. And I wrote down to follow up with you, Christina, about NAMI and getting an article in there. So family members and clients get more information about that and how do we share that. I think to see real significant shifts and a change, I think it needs to be across the board. It can't just be behavioral health, right? Think about a family who just went to see their pediatrician and they got this serious diagnosis for their child. Why shouldn't a pediatrician refer to a family support person?
Well, on that, can I add that we do have that with one of our local pediatric places here, but the challenge is those children need to be enrolled in a behavioral health home before we can do anything. So we have gotten referrals directly from the pediatricians here, and we will go with them and get them enrolled in that behavioral health home. We can do all of those things. That challenge is still, I think, on the education piece. When parents call to set up their appointments for an intake, people on that line, for whichever behavioral health home they go to, are told when they're little, well, what do you want? Are you sure? We only do medication. Parents get really concerned. They don't want their 5-year-old on medication. And so, again, I think it all goes back to that education piece. And if we have those relationships, if I can know who to call specifically, then we help coordinate that. So I do think there is some shift in changing with that, but I do think that's a big system barrier, is that all kids, in order to get our family run services, need to be enrolled in a behavioral health home.
So there's an example of how do you remove that barrier. I was thinking even, I guess, Trish, I was thinking bigger than that. So why should a child have to have a behavioral health diagnosis to come to you? Mm-hmm. Why should a family, have to have that to be referred? We tend to treat ourselves, separately instead of a whole person. I don't know about you guys, but when I'm not feeling well, physically, it impacts my mental health. Right. And if I'm struggling to sleep, it impacts my physical health. Or if I'm struggling with anxiety, it impacts my physical health. So I think we want to see true systems change. I think it needs to be across the board. Access talks about whole person care, and they drive it through the behavioral health system. Why aren't they driving it through the entire healthcare system? Why do we expect why do we expect just the behavioral health to go and do X, Y, and Z and not large hospital systems? If you want to see change, require Banner and Dignity and all of these large health systems to work differently. Require them to partner with their community. That's where I think you break down the barrier, or we get past where resource rich and coordination poor. I don't know. I just, and I'm thinking probably really big, and that might be beyond what NAMI wants to take on from a systems change. But I think primary care and hospitals need to have behavioral health embedded. I think that peer run and family services need to be engaged with pediatric practices and, again, primary care practices. We know people with SMI die 25 years younger. Why is that? Because they don't feel comfortable going to a primary care. Can you imagine if a peer was there to greet them, just like a peer's there at our crisis center? What a different experience that would be. But we don't do that. We don't require our healthcare system to function differently. We require behavioral health too.
Right. And yes, I totally agree with you. And I think the differential factor for me is really knowing that you got these specialized services within our Medicaid system. With private health insurance, I don't have that, right? And so I don't have youth mentorship, peer support, or family support covered under my insurance because I'm not with Medicaid, right? So, well, if I take my son to a pediatrician, my pediatrician is going to tell me, sure, you can go see a psychiatrist or a, dermatologist or whatever the case is based on my son's need. He'll make those referrals and he does a really good job of the coordination. So I see in some regards, he's exactly how I would love to see more people act, right? Where my same son was just diagnosed with ADHD 2 weeks ago. I was given no referrals, no options, anything other than a prescription to my Walgreens to medicate him, right? Nothing was I offered. And this provider even knew I was in the mental health advocacy field and sort of had an idea of who I was. But there was no options, no choices offered to me, right? And this just happened 2 weeks ago, right? So I think in many ways, Medicaid and the services that we offer and the services that we provide sets the stage for the rest of our healthcare system, right? So in order for us to say, all right, private healthcare, you need to provide choice. We need to make sure our Medicaid system is providing that choice as well, right? So I think while it definitely goes across all lines, it also sort of comes back to like, okay, are we ensuring choice for our members? Are we sharing the wealth of resources that are in our community?
Yeah, and I would just say I think we do a better job, and than the rest of our healthcare system. And if we really want to see a shift, I think all of us need to advocate for our commercial insurances around parity. When I started in this field like 30 years ago, if you had Blue Cross Blue Shield, you couldn't even access substance use services. It wouldn't pay for it. Now look at where we're at today.
Right. Well,
right?
and it's a law now. It's a federal and a state law. So there's
right. But for some, it took that to make that happen. And so I know that was really big, Christina, but I just think that maybe it's really reinforcing parity and holding our health plans accountable for that. Maybe it's continuing to reinforce choice at this level. But if we want to see real systemic change, I think that's where we're going to see it. Right. And then we all just expect it. So, you talk about your son, we offer this amazing service called cognitive function development therapy. And we've had kids with ADHD be able to stop their medication. Right. But you probably don't even get to know that information.
Right.
Right. And so I don't know. I was being bold in my statement but I'll go back to what Trish was saying. Let's remove that barrier.
I appreciate that. It's a great statement. And my only point in bringing that, commenting on that is really trying to figure out like, all right, so how can we impact the whole system? But part of the ways in doing that is impacting our own pocket, our own community, right? Ralph, you had your hand up.
He's been so abnormally quiet.
Well, I'm normally quiet, Kathy. So I just wanted to comment on what Tamara brought up a few minutes ago. And again, we all attending these meetings, I'm very aware that our focus is behavioral health in everything we think and do and advocate for. But she brought up a very important point, and it relates back to our new governor, the Goya Favas and all of that. Why can't we lean on our governor and the Goya people in our advocacy with this idea that these big healthcare systems that treat our physical health ought to get their mind around the whole body. You know, parity was passed back in 2005 when Patrick Kennedy was in Congress. And here we are so many years later. And, you know, it's still separated. Physical health is physical health. And you guys over there, you worry about it yourself. I'll shut up.
Well, I'll just say, building off of that, Ralph, I read this article, and this is probably back in 2014. The World Health Organization did a study of people in the United States. And what they discovered is that 67% of us were not functioning at our optimal mental health, right? That means 67% of us were not coping with stress well, right? We were having difficulties sleeping. We were experiencing anxiety, depression. If you think about that, we need to treat the whole person, right? There really isn't any system or any part of our healthcare system that's not impacted or shouldn't be addressing mental health and substance use and physical health altogether. And when 67% of us have some issue, right, that's preventing us from functioning at our optimal health. So that's where that comes from. So I'm sorry.
I mean, there are some glimmers of hope. For example, here in Northeast Arizona, our primary physical healthcare system is Summit Health. The other day, as part of our NAMI chapter, I got a letter from Peggy Cunningham, who runs the 5th floor, where it used to be administration before they built new buildings. And it was kind of one of these letters that said, you know, we're here, and we're here to treat people beyond, I think it was 55 or something like that, with behavioral health issues. And so you people in NAMI, if you know of anybody like that, you know, et cetera. And then there's been the recent effort with Dan Haley and Hope having a couple people assigned into the emergency department over there. And then I got a couple of phone messages while I was off on vacation from the social service organization at Summit. So my plans for this afternoon are to go over and spend a little time with the Summit people again. Just, they at least are trying to recognize that there's more to it than just, you know, fixing broken bones and treating our stomach ills.
Absolutely. Yeah, that's great news.
And, you know, banners up here with these, what do you call emergent care centers? There's a couple of those up here, one in Show Low, one in Pine Top Lakeside. Are they doing anything in mental health? Not that I know of. I've gone in there and tried to leave flyers for a NAMI chapter, et cetera. And it's sort of like, okay.
So isn't one of the major barriers is mental health, the health record, and integrating that? It's the legalities right now that everything's in place and people want to do it. It's just that it's a huge legal challenge.
You are absolutely correct. It's a huge barrier to coordinating care, to sharing information, to the whole, and I don't know how this group feels about it, but CFR 42 Part 2 or Part 2, but I always get but essentially for substance use really is limiting. And even though they continue to try to change language, it's like incremental change and not really change that I think most of our clients want, right? People want us to talk. They expect us to talk and to communicate and provide the best quality care. But there are definitely old laws or laws that we try to modify instead of blow up, and you know, to really provide the best care that we can. But that's that coordination poor, you know, to talk to somebody if I need a release for not just to talk to, I'll just say Ponderosa Pediatrics, but if I need a release for Dr. Ekman, right? And HIPAA doesn't require that, but on the CFR 42, it does. Although I think they changed that, didn't they, Christina, just recently?
What piece, Tamara?
the release of information requiring a specific person as opposed to an entity. Do you know?
I don't. No.
I wasn't aware of it either.
I think they might change it.
So, George.
Thank you. On my recent releases of information, it has been for specific providers. Now, what I wanted to share with the group, because I think education is a good point, those of us who are older, so I'll let you decide. Half of the kids going into college, or even 2/3 of them, feel that they have an anxiety disorder. In other words, it may not be specific for each child, but that's our future, and so thank you.
So George, to that point, if 2/3 of our kids that are going into college are struggling with anxiety, right? What are we doing as an entire community to ensure that our young adults are getting trained in some basic cognitive function or CBT, cognitive behavioral therapy, right? In Arizona, I think this past year, we passed a law that there couldn't be any social emotional learning happening in school, right? And yet we know we have 2/3 of our kids going on to college with anxiety. Now, if they go to primary care, what's likely going to happen? They're going to get a script, right? Let me give you some medicine to take care of that, as opposed to teaching our young adults, how do you cope with anxiety? You know, what is it about our thinking? What is it about our behavior? What can you do when you're struggling? I don't know about you guys. As a CEO, I have anxiety, right? I'm responsible for a lot of lives. There are days that it's really hard. And if I hadn't learned the skills, right, to get out of my thinking mind that's causing my challenge or increasing my anxiety, right? But instead, we say no social emotional learning in Arizona in school curriculum. So I think we have a lot to do as society. And I think if we're going to drive change, it has to be at the systemic level. Right now, right, we do it. Trish and her team knows my baby team, and that's really good. That's not going to drive change. It's good enough for now. And we've gotten a lot. We have removed a lot of barriers by developing this relationship. But if we're going to see real change, we need to see it on the system level. How we provide healthcare, how we engage, how we treat. Like the majority of meds that get prescribed happen at the primary care level. Why shouldn't there be behavioral health services there? And why shouldn't we expect all payers to pay for that? I can tell you as a mom, when my daughter was diagnosed with cystic fibrosis, I went home and I sobbed. I had a great care team, a fabulous physician. I had a great LCSW social worker on my team who also blamed me, right? I had a physician tell me I was being an overreactive, overprotective parent. 3 days later, my daughter was hospitalized because actually as a mom, I was just attuned to her and knew what needed to happen or that something was off, right? And so again, I share this with you because I think whether you have a primary behavioral health, primary physical health, someone who's had a heart attack is going to struggle with depression and anxiety as they get back into society. Why don't we refer them with their diagnosis being they just had a cardiac arrest? I think we need to be thinking about how we provide healthcare differently. And to Christina's point, it starts with us today, right? So Trish already talked about our partnership with primary pediatric. We have a same partnership. Actually, I think it's Ponderosa that we do together. I'm not sure. We're actively working with physical health providers to try to remove those barriers. Ralph, you just talked about Summit, who's doing some things. If there's anything that NAMI or the peer support can do to raise that at the state level, and help our whole system think about not just developing policy for behavioral health, but developing policy for whole person health, and think about how that can change at least Arizona, right? We can start here. We can come up with some models and show the rest of the country how we can do it, and how, you know, peers can be embedded and family support can be embedded in ways that we don't even think about right now.
Well, I think that we are recognized as a state for peer and family support. I mean, I know when I go and speak to conferences on a national level, you know, people come running up. You're just so fortunate. And I'd also like to remind everyone, you know, when I was in the state hospital and then spent 7 years in institutions, none of that would have happened nowadays. You know, I mean, I think we as a community, as a state, have affected tremendous change. I see it just the time that George and I were working in this, it was hopeless. I remember walking by a provider and looking in the window and seeing all their books with all the names of patients on it right there. You know, I mean, it's just the simple little things, but we have affected tremendous change. And as we move forward, it sounds horrible in the sense that some of the stuff Tamara has been talking about, but it's going to happen. You know, it's going to happen, but it would be nice if it happens sooner than later. And once it happens, there's going to be other challenges. I think one of the challenges that George and I have seen over the years is we fix one thing and then we go on and pay attention to something else. And all of a sudden, the first thing we fixed is unfixed again. And we go, oh my God, but it's not as bad the second time around. So I think we need to keep that in mind. So there is a lot of hope. So at this point, I'd like to ask Suzanne, is she still on? Or
she just left, she had to leave.
Oh, she had to leave. Or Patty or Rose. And of course, Sherry, you always have something to say. You guys have been very quiet.
And Patty.
And Veronica. Oh, yes, there's Sherry. You're on mute, Sherry.
No, I'm unmuted now. Can you not hear me?
We can hear you.
Oh, okay. I was just sitting here thinking about educating the healthcare side of the house. We've got that Hearts and Minds program that's perfect. And it's not something you have to go week after week for. It's something you can do, you know, maybe half day or something along those lines. But basically Hearts and Minds is just, that's what they talk about, is that it isn't just your mental health, it's your physical health. Everything has to work together for it to all work.
And we have Ending the Silence. And Tamara has talked about, you know, children. We can't, you know, Will, what's his last name?
He's here.
Oh, Will. Where is Will?
Will Evans.
It looks like he's got the moon.
Oh, he's out in outer space again.
Yes, he's.
And so Tamara, I don't know if you know Will, but he works for Spectrum. He's on the crisis team, but he's also been hired for NAMI at the state level to institute Ending the Silence here in Yavapai County. Maybe you could have some time and open some doors for Will, because this is such a, you know, knowing the right person, it's still kind of the good old boys club, and it's very difficult for us to get in. And maybe you might have time to just have a little chat with Will.
Yes, Will,
it's a tremendous program.
Well, I've worked with Katie Welty since the beginning, and Lori actually hired me. So you know how far back we go. And everything we're talking about, you know, if you need a point of contact, our regional VP, you know her, gave me some wonderful dispensation to do lots of things. So yeah, please feel free.
Well, Tamara just put her email in the chat. So if you want to make note of that and reach out to her.
Okay, terrific. Great, thank you.
That would be great. Thanks, Will.
Veronica.
Veronica, with North Country, you're an example of, I know you haven't been there all that long, but here's a physical health provider that, you know, what's the component in Flagstaff for North Country? with behavioral health and peers?
I actually don't work in the behavioral health department. I actually work in outreach and enrollment. So but I have a background in that, and just understanding how my position, working in the community, providing different opportunities to be connected with the right providers. I was recently able to connect Winslow Unified School District with our behavioral health, and it was in reference to Jake's Law because they were amending or updating policies. But a lot of the disconnect that you guys were talking about is that, especially with the pediatric portion, is just that red tape. And I'm in support of whoever, I can't remember who mentioned it, but getting the Governor's Youth Council involved as far as the advocacy part, to let them know that this has become something that's important statewide, that it doesn't just need to focus down in the valley. And I know for a fact that with Northern Arizona, especially the behavioral health portion that's offered out on the reservations in Northeast Arizona, the caseload is so high. There's very few specialists to work with children, and the waiting list is forever. So a lot of the time, nobody's getting the help they need. There's been quite a bit of focus groups open to the youth to try and get involved with, but it's just not, it's not their area that they want to talk about these things. They want to have the ability to have someone to talk to one-on-one that they can build trust with. And even as adults, they want to have that consistency. The former program that I worked with in regards to outpatient therapy services for substance use, the clients, they themselves mentioned it to our leadership at one point in time. Why do I have a different clinician every 2 weeks? Why are you guys rotating your staff consistently every 2 weeks? I have to develop a whole new relationship over and over again, just because you think that it's good for your staffing to get to know everyone across all locations. When it doesn't benefit the clients at all, they start regressing. They don't want to do the work as far as making sure that they're taking those opportunities and steps to stay on that road to recovery too. So yeah, I honestly, like I said, I have a really good heart for those that want to start advocating at the state level with the governor's office and the youth council. I mean, they meet once a month and they open that meeting up to everybody. I haven't heard anything, honestly, at this level wanting to have their support or their input to begin advocating for those types of services.
Get in touch with Christina.
Okay.
You got another
one, but that's my
Thank you very much.
No problem. Sorry, my screens keep switching on me as I'm doing multitasking.
Patty?
Hi, Kathy. You're going to call on me and make me talk, huh?
I am. You know I'm horrible about that.
I have been multitasking and listening. You know, with us being kind of new in the area, and I don't know if you're aware that we have just received our BH license. So we're expanding our services. You know, we've been providing advocacy in Yavapai County now for about 3 years. So this meeting has just been really informative, and what an amazing group. And I've loved hearing about the connections between our mental health and our physical health. And I'm just soaking it in, and really, really love this as a resource. And I'm looking forward to becoming more involved for sure.
Oh, great. And thank you. And if we can help or do anything, you know, just let us know.
Absolutely. I will be leaning on you, Kathy.
All right. Christina, I think we've gotten everyone. Christine, oh, Sandy, did you have any comments or concerns?
No, I've just been listening and taking it all in. Thank you.
Okay, we'd love to hear if you have anything to share. Christina? Oh, there you are. Okay.
Yeah.
Go ahead and kind of wrap this up.
It's time for Lori to do updates.
She just got, Lori? Let me get her. Oh, keep going until I get her. Something just
all
happened.
right, I can do the updates then. All right, so Mental Health Monday is next month. It's always the 4th Monday of the month. So that would bring us to June. This month was earlier because of, I'm sorry, it's always the last Monday of each month. This month was earlier because we didn't think you would want to show up on Memorial Day. So next month it is Monday, June 26th. And we also, as Kathy mentioned, we will be in Kingman tomorrow for our road show with Care First. So if anyone wants to travel up there and see us in person, you are welcome to do so.
Hear about the Capitol.
We had a mental health day at the Capitol on May 1st. It was a very well attended event. We had a number of different mental health advocacy groups there. We did have the governor proclaim May as Mental Health Month, as well as both the House of Representatives and the Senate also proclaimed May as Mental Health Month. So they read the proclamation on the floor. We definitely have their attention around mental health. And right now we feel as though some of them are definitely listening, which is exciting. All right, and then the NAPFC has their next meeting. Kathy, do you know when their next meeting is? It's the 3rd.
It was just yesterday.
Yep, so the next one will be June 21st. And again, this event is a partnership between Northern Arizona Peer and Family Coalition and NAMI Yavapai. So if you're interested in seeing this recording after the fact or sharing the recording, you can go on to NAMI Yavapai's website. It will be up there for viewing.
And then could you share a little bit about my favorite, House Bill 1710?
Senate Bill 1710. So that is a bill that would remove the Maricopa cap on ASH at beds at the ASH, Arizona State Hospital. And so we've been very involved in advocating on that. We are in opposition to that, as though we feel we need to fix what's going on at the Arizona State Hospital and make sure that they can meet the needs of the individuals that they're serving before we put more people in those beds. So we've been meeting with the governor's office and many other advocates talking about what we can do, as well as how we can serve our intellectual and developmental disability population. Right now, those individuals are sort of being thrown into a black hole when they enter the Arizona State Hospital. So a lot of issues that need to be fixed in that space. And for those of you that didn't see the budget, we also, many of you know that we do not believe in secure housing. We believe in making sure we prevent, fix the gaps, fill the gaps, and prevent folks from getting to a point where they need the Arizona State Hospital secure housing or jails. And so we did see the governor remove some of the money from secure housing, or reappropriated, I should say, from secure housing to help support our kids care program and other preventative services. So we are making some strides.
I'd just like to share one thing. We're under a new administration, and I think there's a great deal of hope with the new governor. At Access, we have a new person too. And so, you know, we kind of got the message when we were at the governor's office to, you know, the past is the past. We need to move forward, and especially some of this challenge with the Access fraud, which is so serious. But let's not get political and put things in there that don't belong. There's a lot of talk and a lot of using this on a political level. So let's just be careful and be positive and work together as a community rather than being torn apart by this. Is that it, Christina?
Yep, that's it.
Okay, so I want to thank everyone for participating. Tamara, thank you so much. Any parting thoughts?
Just thank you for the important conversation. I feel privileged to have been invited and to participate with all of you today, and look forward to seeing how we can continue to do the good work that we're doing, right? To challenge the system where we need to challenge it, to embrace the system and nurture it where we need to be doing that as well. And so thank you. I appreciate the invitation.
And this conversation doesn't end here. We will continue the good work. And so thank you very much. And we will see everyone.
And Kathy, Trish, Kathy, thank Trish.
Oh, Trish. Oh my God, Trish. Thank you, Trish. You've been such a good support. We've been good partners for all these years. So thank you. Oh, here's Lori. Did you have anything else to say about, I think we updated them on everything.
Okay, sorry, I'm multitasking with my other job. And so I just want to thank everybody also. And of course, we have our NAPFC meeting on the third Wednesday of each month from 1 to 2:30.